Chronic Balanitis. Can circumcision help? Hello and welcome back. Today's question is from Tony in Indianapolis. I've been getting reoccurring episodes of Balanitis. What am I doing wrong and how can I stop it from showing up? Someone said circumcision may help, but would it? Balanitis is one of those all too common issues that affect men. And while most times it's a minor issue, it can be a quite irritating and painful when it keeps rearing its, no pun intended, ugly head. For those men that don't know, Balanitis is an inflammation or infection of the skin on the glands or head of the penis. For uncircumcised men, this extra flap of skin is called the foreskin. It's important to note that men who are circumcised can contract Balanitis as well, though it is more common in men who are not. First, let's quickly run through the symptoms of Balanitis. The first is an itching or burning in the reproductive region. Another is a red, aggravated rash on the head and the shaft of the penis or beneath the foreskin. Finally, there may be white, chunky, or yellowish discharge from the foreskin or affected skin. To answer your question, Tony, first we need to identify the cause. Here are a few of the most common ones. Lax hygiene, diabetes, STIs like herpes, allergic reactions, psoriasis, tight foreskin, and yeast infections. Let's take a quick sideline and talk about a major connection between diabetes and Balanitis, since it is one of the leading causes of chronic Balanitis. Men with diabetes have a higher risk of Balanitis if they do not watch their blood sugar. High blood pressure causes elevated blood sugar levels in urine. Inevitably, a small amount of urine can dribble into the penis under the foreskin, creating a bleeding ground of yeast and bacteria, leading to infections and Balanitis. This is how chronic Balanitis happens. Now, let's get to treatment options for Balanitis. Most cases of Balanitis clear up in less than a week, usually in the neighborhood of 3 to 5 days. Treatment largely depends on what caused the Balanitis in the first place. For men who experience Balanitis due to a lax hygiene, gently and thoroughly cleansing the penis can clear things up in a few days. Sometimes a doctor will prescribe a cortisone topical medication to speed the process up. However, it may be diagnosed because cortisone can make the situation worse for some men. Cases of Balanitis that evolve into infections with skin bacteria will require an antibiotic cream after cleaning, and sometimes oral antibiotics will also be necessary. If Balanitis was the result of a yeast infection, it'll require an antifungal cream. Most times an over-the-counter cream works fine. This cream will need to be applied 2 to 3 times each day for at least 10 days. Some doctors may opt to prescribe a stronger cream as well as an oral antifungal treatment as well. Recommended a prescription antifungal treatment either in a cream or pill form. Some doctors may opt to prescribe a stronger cream as well as an oral antifungal treatment as well. Recommended a prescription antifungal treatment either in a cream or pill form. Once a man begins treatment, he does not need to avoid sex, though it may be more comfortable to take a sabbatical from the sheets. Now let's talk about chronic Balanitis and circumcision. It's not something to go in casually. Some uncircumcised men experience chronic Balanitis either as a result of hygiene, phimosis, or as I've already mentioned, diabetes. A circumcision is a treatment often for these men, though a somewhat painful one as a man gets older. Adult circumcision is a surgical procedure where the skin at the tip and in some cases shaft of a man's penis is removed. While Balanitis is still an issue that affects circumcised men, it is often experienced less often and at a lesser extreme. What can you expect if you get a circumcision? It's not a walk in the park and it will be uncomfortable and painful. Recovery generally takes 4 to 6 weeks, during which a man must refrain from sexual activity. The first week of recovery will include antibiotics, pain medications, and rest, but most men can get back into the swing of things after. Though intense exercise is restricted the first 2 weeks of recovery to allow the stitches and incisions enough time to heal. Finally, let's talk on how to prevent Balanitis. All men, whether circumcised or not, should make it a top priority to practice regular, thorough penile hygiene. This means washing daily with warm water and a mild body wash, and be sure to retract the foreskin fully if the foreskin is there, and carefully wash the entire area. After a methodical washing, Rinse the entire area well. Again, retract the foreskin to ensure no soap is left to irritate this very delicate skin. Follow up by air drying or pat dry the area with a soft, clean towel. Afterwards, apply a specially formulated penis health cream health professionals recommend Man 1 Man Oil, which is clinically proven mild and safe for skin each day to keep skin moisturized and fresh. These creams are chock full of vitamins and minerals like vitamin C, which increases collagen, giving the skin much needed elasticity, and also boosts blood flow for firmer erections. Use daily or multi-daily for best results. Man 1 Man Oil is available now on our website at man1health.com and on eBay, Amazon, and the Walmart marketplace. Thank you for tuning in, and I hope to see you again soon.